Hello, my name is Joseph Salvucci, and I chose to do my research on obsessive compulsive disorder, or OCD. OCD is an anxiety disorder in which an individual experiences thoughts that invoke ritualistic behaviors and actions. These thoughts are known as obsessions, whereas the actions are defined as compulsions. In most cases, a sufferer of OCD generally experiences obsessions and compulsions as a cause and effect relationship. These symptoms can be extremely detrimental, frequently interfering with an individual's daily life. OCD is experienced as a cycle made up of four phases: obsessions, anxiety, compulsions, and relief. Obsessions are unwanted, distressing thoughts, urges, and mental images, while anxiety may be distress, fear, worry, or disgust drawn out from these obsessions, and compulsions help deal with the anxiety. They're a coping mechanism in a way, and relief is experienced after compulsions are acted on and is only temporary. There are many causes and types of OCD. However, there are five main categories, which are checking, contamination, hoarding, symmetry or orderliness, and rumination. Checking is the most common form of OCD, and it is a deep-rooted fear of harm if things aren't checked. Individuals will often check their memory, appliances, illness symptoms, locks, wallets, and even people. Individuals can spend hours on end checking things at their house before they can even leave, which can ultimately negatively impact their work life and their commitment ability to timed situations. Contamination is the second most common form of OCD, and it is the deep-rooted fear of harm or even death if things aren't cleaned. It's often triggered by public toilets, shaking hands, visiting hospitals, being in crowds, and touching heavily used surfaces. This can be detrimental to daily productivity and pose certain health risks with constant washing. Hoarding is probably the least regarded OCD form, but it is still a type of OCD, and it is the inability to discard useless or worn out possessions. There is an irrational fear by the individual that harm will occur if personal possessions are thrown away. There are three types: prevention of harm hoarding, deprivation hoarding, and emotional hoarding. Individuals will develop relationships with their possessions rather than with people, and this can pretty much cause ruined relationships, health issues, and impairment in everyday living due to their lack of living standards. Symmetry and orderliness is probably the most well-known symptom form of OCD, and it is the compulsive act of keeping things aligned symmetrically with the obsessive fear of harm occurring if things aren't aligned perfectly. This can be exemplified by a person's extreme neatness, and when all of the possessions they own are perfectly organized and aligned, you can notice that. But this can also be more of a social symptoms too, because individuals may avoid social situations to prevent the symmetry or order in their lives from being disrupted, which can ultimately cause loss of relationships and jobs. Rumination is probably the least understood and least able to see form of OCD because it's completely internalized. It's obsessional intrusive thoughts which manifest a person's mind throughout everyday life. It's most common concerned with personal relationships, sexuality, religious practices, and even violence. Compulsions occur as an avoidance of such triggers like places, objects, and people, and ultimately it results in increased levels of chronic anxiety and relationship issues. While this area of psychology is relatively new, we do have theories of potential causes, which are genetic, neurological, behavioral, cognitive, and environmental. Genetics shows the most substantial evidence. There have been many studies that show that relatives are at a much higher risk of developing OCD. There are two potential genes we know of that are when there are mutations displayed. There's an increase in neuron activity. These genes are HSERT and SLC1A1. The neurological standpoint looks at the brain and how the activity in the brain works during times of symptoms. The abnormal areas of activity are in the orbitofrontal cortex, anterior cingulate cortex, striatum thalamus, anterior cingulate, gyrus, caudate, nucleus, basal ganglia. And the circuit connecting all of these areas is associated with the control of urges, which is why we're looking at these images and during times of when someone has urges. The behavioral standpoint looks at how individuals associate specific things with fear, and instances of ritualistic behavior may begin during periods of intense stress, and obsessive compulsive behaviors may offer relief from feelings of fear. Like the behavioral standpoint, the cognitive standpoint looks more on misinterpretation of thoughts, and individuals with OCD exaggerate relevance and importance of intrusive thoughts. Environmental factors are also substantially supporting the causes of OCD from studies which have shown that they may contribute from 53 to 73% of OCD symptoms. Traumatic life events are seen to be associated with OCD. Because this area is still relatively new, we don't have a cure, obviously, but two treatment options are medication and therapy. So the medications we know of are selective serotonin reuptake inhibitors, which help regulate the serotonin levels in your brain. And therapy helps give a person the tools they need to deal with the thoughts, the intrusive thoughts they're faced with throughout their lives. And treatment options can vary completely based on the severity level and just the type of OCD they have in general. And though treatment may significantly help people with OCD deal with their issues, it will never be able to completely eliminate them. So that is the most important of all my findings about obsessive compulsive disorder. Thank you.